Hi everyone, my name is Jamie and on behalf of Lung Foundation Australia, I'd like to welcome you to today's webinar. Before we begin, I would like to acknowledge the traditional owners and custodians of country throughout Australia and recognise their continuing connection to land, water and community. I pay my respects to all First Nations people and acknowledge elders past, present and emerging. So today's webinar will provide you with some unique insights into the use of technology and devices for the management of your lung condition and is brought to you in collaboration with the Centre of Research Excellence in Pulmonary Fibrosis. So I'd now like to introduce our speakers for today. We're very pleased to have Greg and Timothy joining us today. Greg was diagnosed with IPF almost 3 years ago and has used computer technology for more than 35 years. And continues to be amazed by the extraordinary developments in this space over the last 15 years. Timothy, who has worked as a carpenter, has found that technology has been a big part of his life for many years, particularly over the past 6 years since his diagnosis with chronic obstructive pulmonary disease. So we're also very pleased to have Professor Anne Holland and Dr. Laura Glenn joining us. Professor Holland is a Professor of Physiotherapy at the Monash University and Alfred Health in Melbourne, and is also the Chief Investigator for the Centre of Research Excellence in Pulmonary Fibrosis. Dr. Laura Glenn is a respiratory consultant at the Royal Prince Alfred Hospital and also commenced a PhD in 2020 within the RPA's Interstitial Lung Disease unit. So we're very fortunate and grateful to have you all joining us today. To start, I'll hand over to you when you're ready, Anne.
Thanks very much, Jamie, and welcome everybody. It's a pleasure to be here today to talk about the different ways in which technology might be helpful to assist with self-management in pulmonary fibrosis. So I'm going to start with asking Greg about some of his experiences. So Greg, are you able to tell us something about how you are currently using technology in managing your pulmonary fibrosis?
Yeah, certainly. I'll just preface that by saying technology isn't only computer technology. There's a whole lot of other tools we use to get things done, which don't rely on computers. And I'll also mention that when Jamie mentioned the last 15 years of the developments, it's particularly the significant developments that have happened with portable, smartphones and iPads and tablets, which has made a phenomenal difference to what's possible to do. I've also had the fortune to be a member of an Apple user group in Melbourne for many, many years, which is a great sort of self-help support group. So technology-wise, I've had a fair bit of experience in all the pros and cons. What do I use technology for? I mean, it's a physical exercise, gyms, treadmill, bikes. I use technology to communicate, document, record, measure things, to communicate with others, health professionals, family, friends. Access libraries, repositories, courses, self-help groups and so on, and research my lung condition and its management and maintain my personal interests and hobbies. The particular things, I've been involved in 3 separate but related lung or pulmonary exercise programs over the last 3 years. First one was a really nice face-to-face one at a physiology gym, a physiotherapy, gym, which involved, cycling, treadmill exercise and weights and so on. These are 8-week courses, twice a week. Similarly, last year, during the lockdown in Melbourne, we did a similar tried to do a similar sort of thing with a home-based program, which involved a once-a-week session with a physiotherapist. And it was just really more monitoring my health goals and sort of talking about what sort of exercise I was doing and how things were progressing generally. And the third opportunity I've had more recently was involvement in a research project, which involved where I was actually loaned, and here again, still in lockdown in Melbourne, and it was loaned an exercise bike, an iPad, an oximeter, and similarly an 8-week program, twice a week of exercise, monitoring how things were going. So I've sort of had some experience in both face-to-face or home-based and with equipment loaned and doing literally sessions via Zoom, which.
So how did those experiences compare, Greg, if you had to compare, say, face-to-face rehab in the gym to an online virtual group where you were seeing people on your tablet?
Yeah, basically face-to-face and video conferencing, they're essentially two ways of achieving the same outcomes. Content is really similar. The environment in which you do it is different, and there are some interesting differences there. I mean, face-to-face is unique because you're simply there in the same physical space with the health professional. You can sort of ask questions. You've got support immediately, literally on hand. You can try various combinations of equipment, those sorts of things. The remote or video conferencing, its particular advantage is it just obviates the need for distance. I mean, distance isn't an issue. Geography is not important anymore. So it enables participation in things which you wouldn't be able to do at all otherwise. So they're both, I found them both very positive. There's a sort of slightly bit of a different setup in actually doing each. If you've got an exercise bike at home with an iPad sort of facing you so that you and the health professional can see each other, the professional can see the oximeter and the readings because that's being monitored while they're exercising. Couple of factors which don't apply to face-to-face things. You're talking about internet connections, audio and visual quality, lighting, so that, you actually, people can see each other and what they're doing and see the detail they need to see. Where the equipment is placed can be a factor. I mean, in a gym, it's purpose-built, so you just go there and you do it where it's all set up already. One interesting thing was there's a potential privacy factor where if you're in a group, everybody can hear everybody else, because if you're exercising on something, you generally can't press a mute. You're not in reach of a mute button to for example. And the other thing was, if there are other people at where you live, you need to consider whether you want them to be in on the conversation as well or not.
Absolutely. Different considerations.
I've found them, or both avenues, to be pretty much equally effective.
I might bring Tim in here now, if that's okay. Welcome, Tim. Good to see you. I know that you've also had some experience with remote rehabilitation programs. I wondered if you wanted to tell us a little bit about how you found that.
Yes, I was diagnosed about 6 years ago of having OCPD, and I was working as a carpenter up until then. I went to the Alfred hospital, and I did seen all the doctors there, and they put me onto the course of pulmonary rehab. I did an 8-week course there. Then that was face to face, and after I did that, I stopped for probably a couple of years. And then I got called up, and they wanted me to do another rehab course. And the second one was over the tele rehab, because I have all my own equipment. I've got a bike, I've got a treadmill that I use at home. I've got my own iPad. I just had to get an oximeter meter, which because I'm on oxygen as well now, I happen to be able to get relatively easy. So I've got all my own equipment, which makes it a lot easier for me to do it from home. And I found the working from home was a lot easier for me, because I've got to travel a fair way to get to the hospital to do it. And the time it saved gives me back that time to do other things during the day. And I found it just as good doing it on the tele rehab, because you can still ask questions. They're right there with you, and it's just as easy as when you went there.
Fantastic. Good to hear. I wondered, Greg, whether you would pick up on one of the things you said earlier about using technology for communicating and recording things. So do you want to tell us a bit about that?
Well, it was, I've used it, it's essentially a note-taking application, for example, to just make notes of the sort of sequence of events, appointments, what your questions you might have asked your professionals, what the outcomes were, documenting. And these days, with the apps that are available, you can include attachments of various sorts. We can probably even include a video of yourself, or sort of photos of things if you wanted to include them. One of the apps that was used in one of the sessions was good. It was actually controlled by health professionals, so I can't actually put a program into it, but it actually had videos of the exercises, someone actually demonstrating how they were. There was a list of the instructions, an account as well, and there was an opportunity for you to record how much you'd achieved, whether you achieved the number of repetitions, the number of sets of a particular exercise or not. So that was particularly useful in terms of, and that record's available. One of the other apps that was recommended by a physiotherapist, which is called Map My Walk, which means if you're walking, it'll actually literally document where you've walked, the pace at which you go, how long distance you've covered, the elevation you might have gone up and down, all those sorts of things, which is all useful to have a look at over time to see what the pattern, or see whether there are patterns, whether you're increasing your achievements or whether things are decreasing or whatever it may be. So that's the particular a couple of particular sorts of things.
Great, thank you. And do you have any particular tips and tricks that you'd want to tell people who are thinking about using technology to help manage their pulmonary fibrosis?
Well, yeah, so there's a couple of really general ones, but they're really important. For people who are considering using anything, I mean, there's such a wide range of things available with sort of personal use, but try not to feel intimidated by technology because you can't break anything. It's not really, it sometimes breaks itself, but you can't do anything really to make it not work. And being afraid of the unknown and initially being confused or uncertain is perfectly okay. We've all deal with those sorts of things. As far as technology, use what you're familiar with. If you've already been using a particular platform or device or whatever it may be, don't feel you need to change just because there might seem to be one with more bells and whistles or something, because it's not necessarily. Use what you're familiar with. Ask questions, read guides, ask your health professional for recommendations, advice. And one of the key things, and the Lung Foundation, Australia does this really well, is learning from each other, that incredible and value you can get from support groups like Lung Foundation Australia, its website and the information and support services they offer. There's also a whole lot of other things, men's sheds, University of the Third Age, computer user groups, local councils on the ageing, all sorts of, try and find ways to tap into those sorts of resources which are there and which can help you achieve, looking after yourself.
Fantastic. Oh, great advice. Thanks, Greg. And Tim, how about you? Do you have any particular tips and tricks that you'd like to share or things that have worked for you over time?
I found using the Zoom has been relatively easy because you use it keeping in touch with all your family and stuff. So it's the same thing when you're going to keep in touch with the doctors and that and doing all that sort of stuff. And I use a treadmill and the oximeter meter, and I find occasionally, because I'm one of these people that has cold hands and the oximeter meter doesn't work properly every now and again. So I find if you either change hands or just change fingers, it brings the oximeter meter back to working the way it should.
Yeah, great point. And sometimes, you know, when it's winter or when your circulation's not so great, it can be difficult to get a reading. So that's a really good strategy. Thank you. What I'm going to do now is I'm just going to briefly run through a few slides which talk about some of the range of technology options that people have available to them. So this is a slide which shows some of the tele-rehab setup that both Greg and Tim have been talking about in the past few minutes. So just wanted to put it up there to give a sort of a visual image, I guess, of the types of things that we've been talking about. So this setup doesn't use any particular special equipment. It just uses a sort of bog standard exercise bike you can get from the shop. We chose one here, which is a step-through bike, so you don't have to put your leg up and over something in the middle. It makes it easier to get it on and off. And you can see here that there's an oximeter that's affixed to the front that can be seen by the physio or the exercise physiologist on the other end, and a tablet computer, which means that everybody can see each other and talk to each other and you know, chat through the group as you might when you're in an in-person group, and the health professional can provide that sort of coaching and supervision that they normally would in a rehab program. So there's many different ways to do this. This is not the only one, but I thought it just might be useful if you haven't seen this set up before to get an idea of what it looks like. So I thought it might also be worth saying something about pulse oximeters because they've come up a couple of times already today. So pulse oximeters that you use at home are really there to give you a bit of a spot check of what your oxygen saturation is doing. And you might be doing that at rest when you're sitting down, not doing anything. You might be doing that during exercise, which is what we've talked about already a little bit today. And as Tim also alluded to, you might be doing that during oxygen therapy to check where your oxygen saturation is sitting when you're getting extra oxygen. So this is something that can be very useful for self-monitoring. We say that it's not necessarily for everybody, so not everybody needs it. It's not relevant to everybody. Some people find it useful to just get a bit of an idea whether their oxygen saturation is sitting where they expect it to be. Some people might use it during their oxygen therapy if they've discussed it with their healthcare team to turn the oxygen up when they might need it. If that's part of their oxygen prescription, it's not for everybody. And some people find it useful, you know, to monitor themselves over time to get an idea of what's happening sort of, you know, month to month and over the course of months and years. So it's not there as something that you need to do all the time. It's not designed as something that you need to, you know, be looking at many times throughout the day, but it can certainly be a useful spot check in some of those circumstances. There are a lot of different oximeters available now. They vary in quality, so you do have to, I think, be a little bit careful when you purchase that you are getting something that seems like it would be a reasonable quality oximeter. Some of the very, very cheap ones are not necessarily going to give you an accurate reading, but there's also some quite good ones out there that are reasonably priced as well. So I think the most important thing with the pulse oximeter is it's important to know what's normal and expected for you, because it does vary from person to person. So that's something to chat about with your healthcare team. You know, not everybody's resting level of oxygen saturation is the same as the next person. So it's good to know what you should expect when you put the monitor on your finger. Sometimes these readings can be a bit less less accurate when you're exercising or moving around, depending on the device. Some of them don't cope terribly well with movement, so that can sometimes give you slightly difficult readings. And if you've been exercising, it might also give you a lower reading, because for many people, their oxygen saturation might be a bit lower when they're exercising compared to at rest. As Tim's already said, the measurements can also be affected by things like having cold hands or poor circulation, and even things like having really dark nail polish or your skin pigment in some people can affect the reading as well. So it's just important to know those things, to be aware that the readings are not necessarily the same all the time. If you're thinking about getting a pulse oximeter, I think it's worth talking about your treating team about whether your treating team about whether it would be useful for you and how you might go about using it in order to make it useful, to ensure that it really helps your self-management and, you know, informs you in a way that doesn't stop you doing things but helps you to do more. There's, of course, a lot of quite simple things in consumer devices that can help with monitoring and self-management as well. So this is just data that I've pulled off my smartphone. This is the step monitor that's in most people's smartphones these days. And so on the right-hand side, you can see my steps for a single day, last Thursday. But it can also help you see what's happened over time. So on the left-hand side, you can see what happened over the course of 2020. And we know what happened in Melbourne in 2020 in the middle of the year. It was a very long lockdown, and you can see that there in my steps. So I think that just provides an indication of how these sorts of things can sometimes be useful in terms of giving you a sense of how things like your physical activity levels might be changing over time. It can also be quite motivating too if you've got a target of the steps that you want to achieve every day. These monitors, of course, are not just in smartphones. You can get purpose-built ones as well. These are all consumer devices that are readily available in the shops. There's many different ones, as you can see. Some of them have a display on their screen. Some of them also download to a smartphone, so you can look at things like your graphs over time on your phone or on a computer. They can measure a whole heap of different things. So I've showed you steps already, but you can also get monitors that can show you the intensity of exercise, so how hard you're working, how long you've been exercising for, or how far you've walked, things like your calories burnt and your heart rate, even how long you've been sleeping for and the quality of your sleep. We think that most of these are reasonably accurate these days for steps. They do vary a fair bit for some of those other things though, so they're not always super accurate, for instance, for things like calories burnt, which can vary quite a bit from person to person. So I think when you're using these things, it's good to just have a think about what sort of goals will be meaningful for you. So for some people, it might be to increase the duration of the time that they're exercising every day. You know, if you're aiming for 30 minutes a day, that can be a useful way to monitor it because you'll get the duration of your physical activity. But for other people, it might be more meaningful to think about steps, for instance. So it's really very personal to think about the goals that are useful to you. Just thought I'd briefly mention things like home spirometry, so monitoring that can be done in the home environment, because of course these things are now all possible to do. There's technology that allows you to do things like lung function tests from home. These can sometimes also provide you with the opportunity to monitor your lung function over time, and sometimes it can be monitored remotely as well in terms of being pushed to your healthcare provider. It's not been something that's been particularly apparent in Australia so far, although I know there are some centres who've experimented with it a bit more during the COVID pandemic as a way to provide some monitoring for people who aren't able to come in for a lung function test. What we know about home spirometry is that it can be challenging to maintain over time. And the graph I've just put here on the right-hand side shows the number of measurements taken per week over the course of around about a year. And you can see that it does tend to tail off over time. So, you know, it's sort of not for the faint-hearted. It is, you know, a reasonable effort to do this every day. And for many people, it can be hard to keep it up. The other thing that we know about these sorts of measures is that it can be a bit more variable than the measures that you have taken in the clinic. And this is, I think, one of the reasons why it hasn't come yet into widespread use, because it can be difficult to interpret those sorts of changes when it varies a bit from day to day and possibly varies more than the measures that you do in the lung function lab. Some of these programs can give you things like, you know, advice on your techniques. So you can see on that one, it says the advice is this is a good blow, but still we see that sort of variability, especially for change over time. So this really isn't a substitute for the clinic-based spirometry at the moment. That spirometry you do when you come into the lung function lab, that really will be at this point for most people the way that decisions are made based on the clinic-based spirometry. But who knows for the future? These things are always improving, so we'll see where this takes us over time. It is, of course, possible to record your own clinic data, and Greg talked a bit about this previously about keeping a notes app in which he was able to record, you know, things that happened at his clinic visits and questions asked and responses, etc. And I know a few people who do this for their spirometry results that they do in the clinic. They put them into Excel and graph them over time, which is what I've done here, so you get a bit of a sense of how you're tracking over time. And that can be useful in terms of getting a sense of where you are compared to where you were a year ago, for instance. And also helps you to record any changes to your management plan. So as we were saying before, a lot of these things can actually be quite simple. They don't necessarily need to be purpose-built, and that can, you know, be helpful in terms of giving us, you know, some sense of control and management over what's happening. There are, of course, apps for everything these days. So you can get apps that will help you monitor your symptoms. So monitor your breathing and your cough. Apps for physical activities we've already seen. There's apps that are specifically for medication reminders, that where you put in your routine of when you take your medications each day, and it will send you an alert when you need to do that to make sure that you don't forget and you mark it off. You can monitor your weight over time. There's apps for air quality. There's all sorts of things. And I've just put one example in here today which looks at sort of a lung-specific one with a range of things that might be relevant to people with a lung disease, and also some questions there in terms of sort of symptom monitoring as well. So I think it really depends on what it is that you want to monitor, what's your goal for your self-management, and that will determine the types of apps that you have. So for instance, if one of the things you're really concerned about is making sure you take your medication regularly every day, then you might just go for an app that only does that, rather than something that's more complex. And certainly all of those things are available. And I think shortly Laura's going to tell us a little bit about one that we've got in Australia, which is specific for PF, that's under development as well. So in summary, there are lots and lots of different ways to use technology to support self-management, and some of those are really simple and readily available methods. So things like the physical activity monitors that are in our phone, and air quality apps, etc. Some of them are more complicated and more medical, and they may or they may not meet your needs, and that may change over time. So I think the general principle is that you should talk with your healthcare team about the options that might be suitable for you and useful for you, that would help you to manage your disease better over the years. So I'm going to stop sharing there, and we might hand back to Jamie.
Thank you very much. So we will jump into our first Q&A session now. So if anyone does have any questions for speakers Greg, Timothy or Anne, please send those through. I'll just give us a couple of moments for any to come through. Okay, I might start with one for our patient speakers. In regards to the virtual pulmonary rehab classes, is it something, is it still interactive with the instructor for the classes, as it would be for sort of the face-to-face groups?
I'm happy to jump in there. Yeah, yes, it is. It's essentially no different. I mean, there are obviously some physical, spatial difference and things you could do in a face-to-face session that you can't do when your only orientation is looking at each other. But yeah, no, I have found it perfectly. Communication's fine, not an issue at all.
Okay, great.
Yeah.
Okay, and then maybe for yourself, Anne, are there any different types of devices that help support breathing exercises in particular?
There certainly are some devices out there that do things like link to your smartphone. So there are devices that, you know, essentially act a little bit like an incentive spirometer, I guess, in terms of, you know, coaching for breathing. I've not ever used any of them, so I don't know how well they work, but they certainly are available. I think it comes back again to sort of what your goals are, and, you know, whether that might be useful for you. You certainly would want to discuss something like that, I think, you know, with your healthcare team, just to check that that was something that was right for you, and, you know, what the aims of the treatment were. So yeah, it's certainly available, but, you know, not something that I have used specifically up until now.
Okay, great, thank you. For Greg and Tim, where did you access the exercise programs that you do? Was it all through the pulmonary rehab classes?
Yeah. Yeah.
Yes, likewise, yes. Simply through there, yep.
Great, thank you. Okay, and do you find that your families are confident with you doing exercises at home with only telehealth supervision, so no professional with you on site?
Yeah, I find it quite easy to do. I live by myself, so if I'm doing my exercises at home, and if I have any sort of problem, at least I know that telehealth that's watching me can always call for assistance if something happens to me while I'm doing all my exercises and that. So I feel quite safe doing it like that.
That's a great point.
Yeah, look, I'd agree with that. there is someone there who's actually monitoring you. That may not be the sort of particular purpose of the exercise, but they are there. So yes, and I do live with my wife, so I do. There's someone usually, someone else here anyway, usually.
Great, thank you. In regards to the pulse oximeters, Anne, for people to use them at home, do people need a prescription? I know you referred to the healthcare team. Do they need a prescription, or is this something that they can access on their own?
It is certainly something that you can access on your own. There's many distributors now that will sell pulse oximeters direct to consumers. That degree of sort of choice also, I guess, gives rise to a degree of variability. So I think sometimes it can be hard to sort out the quality of the device that you're getting. I guess one of my tips for that would be perhaps if you're considering purchasing an oximeter, go for a company that distributes it within Australia rather than from overseas, because in order to sell it in Australia, it generally does need to be of a bit better quality than some of the ones that you might potentially just get over the web that come in from another country. So if you can find a company in Australia that's distributing it, that's generally a better sign.
Okay, thank you. That might lead into or answer part of this question as well. Are there any evaluations that do compare the devices at all in regards to the oximeters or similar?
Yeah, there certainly have been those sorts of evaluations done, not by choice that I'm aware, but by other sort of groups, both researchers and sort of, clinic-based groups. One of the challenges with that is that the devices change all the time. So the models get updated, or new models come on the market, or new brands come on the market. So it's not always up to date. So it can be difficult, I think, to get that information that is reliable. The other thing is that sometimes those evaluations, particularly over the last sort of 18 months through COVID, have been done sort of by consumer technology groups rather than health groups. So they're not necessarily, I guess, looking at the same types of issues that might in health. So I really think with that sort of information, if you've got an oximeter that you're interested in, it's good to run it by your healthcare professional and say, this is what I'm looking at. Do you think it's going to meet my needs?
Okay, excellent, thank you. So we might wrap up the first Q&A session for now. And Laura, I'll hand over to you when you're ready. And just for everyone listening, we will go to another Q&A session in regards to Laura's presentation, and then any other for our all speakers we can add in there if we've got time as well. So Laura, when you're ready, I'll hand over. Thank you.
Jamie, can you just confirm that I've screen shared?
Yes, that's great.
Okay, so thank you for the introduction, and I echo everything that Anne and Greg and Timothy have discussed already, that these techniques are something that my patients in the Interstitial Lung Disease Clinic have found extremely useful, particularly during COVID. I just wanted to briefly talk today about an exciting technology-based project that we hope to roll out to patients within Australia following the current pilot study. It's a smartphone application that has been designed specifically for use by patients with interstitial lung disease, also known as pulmonary fibrosis or PF. And the idea behind developing this smartphone app was thinking about novel diagnostic and management technologies in PF, thinking about how we could improve the patient experience and, importantly, patient outcomes, whilst also improving our ability to undertake research and learn more about PF and its treatment. So I'm just going to show you a bit today about how we're planning to do that using this app. So the app we've developed is called Rebuild. It's been a collaboration between a working group in Australia of PF clinicians, including Professor Holland, who's online, other PF doctors like myself, as well as representatives from the Lung Foundation. Rebuild stands for the Registry for Better Understanding of ILD. As mentioned, it's a smartphone application designed for use on both Apple and Android smartphones, and we've developed that over the last 2 years. It's been developed by an Australian-based software developer, in accordance with the working group and also with the University of Sydney and our cybersecurity team to make sure it's a safe app that won't be distributing data beyond for the patient use and for research capabilities that patients have consented to when they sign up to the app. And it's undergone some preliminary testing by health professionals and also by some PF patients through the Patient Advisory Committee with the Lung Foundation. And through all of that, we've made some adaptations to the app, and also we've had some quite good feedback about its usability. And we think it's an unprecedented and innovative approach to patient-centered care and to research. As Professor Holland indicated, there are a number of apps available for self-monitoring in chronic lung diseases, including PF and other diseases like cystic fibrosis and asthma. However, there are a number of features in this app that make it unique that I'll speak to in a second. And also the other thing that makes it novel is that we're hoping to link it with a large research database to include outcomes reported by patients within data points that are collected by doctors. And hopefully that can enrich our existing database and really improve our ability to undertake research to understand this disease and how we can best manage and improve outcomes for patients. So just quickly, again, there's been some research this year in Australia showing that PF patients have actually indicated that understanding the causes of PF and disease progression are among their top priorities. And on top of that, we know that patient-reported outcome measures are important. So measuring patient-reported degree of breathlessness, severity of cough, and other patient-reported outcome measures using surveys and other validated questionnaires are important because they tell us about the patient's disease journey and they correlate with prognosis. So the aim of this app, I've briefly spoken to this already, but in addition to improving our research capabilities by collecting this data, we hope that by including the functions that I'll speak to increase patient engagement with their care, knowledge through some educational activities, motivation and social connectedness. And we also thought that in Australia, a large country where it can be difficult for patients to get to clinics easily, we might be able to use technology to improve access to care and involvement in research opportunities for patients. So I'll just quickly show some screenshots from the app that we've developed. So again, the app is called Rebuild. This bar, the rectangle over on the left, is a screenshot from the bottom of the home screen and showing how that's set up. One of the main functions will be to collect data. So each patient, once signed up to the app, will be able to complete a patient profile with their demographic data, their age, their gender, smoking history, also to record their diagnosis and any other medical conditions. One of the main things we want to do with the app is to enable patients to record their own lung function results, their medications and any side effects, their oxygen levels using a pulse oximeter, like what Greg and Timothy have been using at home, and they can record those in the app, as well as any oxygen use, including what device they're using, rate of supplemental oxygen use and hours of use during a day, as well as these quality of life questionnaires. So you can see embedded within the app, there's a number of questionnaires, including looking at patients' degree of breathlessness, impact on lifestyle, impact of breathlessness and other symptoms on their ability to undertake usual activities of daily living, and things like looking at severity of cough. And so not only does that enable us as clinicians to be able to collect this data and to correlate it with outcomes, but also we hope that by being able to look at this data and look at trends over time, it will be helpful for patients to be able to track their disease journey. Another important and exciting function of the app is the ability to record physical activity. So When signing up to the app, it will ask patients to give permission for the app to speak to activity monitors already embedded within smartphones, and it will access and record patients' daily step count as well as distance travelled, and then graph it over across time, so to provide some longitudinal data. And then we hope that will be a motivational function of the app for patients, and the app is able to give some motivational words of encouragement. If, for example, if a patient has walked more this week than the week before. We're really excited about this function of the app, and we've had some really good feedback from patients that were involved in its preliminary testing. On the home page of the app, the patient will be able to see a display of air quality data. So looking at air quality specific to their location. So it's an hourly feed and will be updated regularly according to air quality data obtained from monitors across Australia. And not only will it provide that number specifically from the monitor, but it provides an indication of what that means. So using the terms good, fair, poor, very poor, and extremely poor air quality. And that's using terminology based on government health recommendations. And then the app also provides some recommended activity and advice regarding staying indoors, etc., for patients with PF and chronic lung diseases. We've established a curated list of educational materials that is also easily accessible through the app. So patients can click on the education button and select videos, PDFs or websites, and then the links within the app take patients directly to these educational materials. And so we've come up with a curated list of videos, for example, looking at exercise whilst managing symptoms of PF, life with PF, how to manage other conditions, etc., and some useful PDF and other websites to support those video material as well. So things to read and watch to educate people about their disease and living with the disease on a daily basis. Additional features are patients can indicate an interest in clinical trials relevant to their PF and submit if they wish to, and they can inform the investigators that they are interested in receiving information about such trials, and then if they do consent to that, then they may be contacted through the app or via email about clinical trials. There's also a message inbox embedded within the app, such that the investigators, so myself and the other clinicians involved in conducting this pilot study, can send out messages and surveys and links to patients. And there's also, importantly, a support button where patients, if they're having any trouble with the app or want to ask us any questions about it, can phone us and or email us about the app. Importantly, I just wanted to mention that this is an incredibly exciting development. I'm very excited about the app, as are the rest of the working group. And the pilot study has gone through our it's gone through ethics at RPA, and we're just waiting final ethical approval at the 2 other sites that will be recruiting. It will be tested in its first phase by 50 patients across 3 sites over 6 months. And that's at RPA Hospital, where I work in Sydney, and 2 sites in Melbourne, the Alfred Hospital and Austin Health. And we'll be looking at usability, whether patients find it satisfactory, easy to use and helpful. Is it feasible, and how often people use it? And it's not yet available for use outside of the pilot study, but of course, we hope that once we've tested it and shown it to be feasible and useful and safe, that we will be able to distribute it for wider patient use. And we hope that that will happen in the future. And there's a lot of people to acknowledge in terms of have helped to design, develop and test the app, including the Patient Advisory Committee through the Lung Foundation, who helped us with the preliminary testing and feedback. And I'm happy to take any questions.
Great. Thank you, Laura. Sounds like a very useful tool, and we've got some questions coming through about when people can access it or be involved, which you've answered at the end there. Are the people in the pilot study, are they all confirmed? Can people still be involved in that?
We actually have not started recruiting as yet. So if people are patients, as mentioned, it's the pilot study. Unfortunately, we've got ethical approval to test it on a specific number of patients, so we won't be able to extend it beyond the 50 once we've recruited. But at this moment in time, we haven't yet recruited anybody, but it will be 50 patients who will be screened and sequentially recruited through those 3 sites, being RPA, the Alfred and Austin Health in Victoria. At RPA, I'm planning to start recruitment in the next couple of weeks, and we're just waiting on final site-specific approval to start at the Austin and Alfred. So in the near future, and yes, there's still opportunity to be involved.
Thank you. In regards to the app, will it also look at pollen levels for people with allergies?
At the moment, we're not looking specifically at specific pollen or specific particulates, but that hourly reading that's measured and recorded in the air quality component takes into account all air particulate matter. And so we know that those levels, the PM 2.5 reading, which detects concentration of particulate matter in the ambient air, will include things like pollens and other dusts that can be associated with exacerbations of lung diseases. So it would be important to patients, but not specifically looking at different types of particulates in the ambient air.
Okay, thank you.
Thank you. Follow-up questions.
No problem, thank you. And will the app be useful for other lung diseases other than pulmonary fibrosis?
This app that we've developed is specifically to pulmonary fibrosis, so the educational material, stuff about clinical trials and the messages that are contained within the app about lung function, etc., is specific to PF. But look, in the future, the vision would be that if it shows to be useful in PF, that the wider research community would become interested in developing similar apps for other chronic lung diseases. We're not quite there yet, though. But as I've said and Anne mentioned as well, there are a number of apps that already exist for patients with other diagnoses like COPD, asthma. Anne may be able to talk to that a little bit more. They just might not have all of the functions that I've discussed for this particular app that we've developed.
Sure. And were you able to provide, in regards to any other apps, is there sort of a list that anyone or any referrals that anyone can access any of the other apps?
Yeah, so obviously we can't provide specific recommendations today, but I would say that the search functions in the app stores are very good. So, if you go to the app store and you put in something like pulmonary fibrosis, it will pull up a list of things that are available, from various sites across the world, and some of those I've shown today. So I think the search function is probably your best bet as a place to start. But also it's worth thinking about specifically what it is you're after. So for instance, if you're interested in something to track your medications and medication reminders, if you put in medication tracker, you'll come up with many options that does exactly that job. So I would start there. I would go through the search function and you'll be able to see the variety of things, and hopefully some of them will meet your needs. In terms of other lung diseases, there are certainly some other apps out there that do specific monitoring for things like asthma, particularly. There's quite a few, but also lung diseases such as COPD. So again, you'll be able to find them through the search function in the App Store.
Great, helps to narrow it down a bit. All right, thank you. So we'll finish up with the Q&A there for today. Thank you so much to all of our speakers for your presentations today. We really appreciate you joining us and sharing your experiences with us as well. It of course comes at a time when people are turning to technology as part of their everyday lives. So it's been really valuable having you here today. Thank you very much. Before we do close today's session, I did just want to refer people just to the resources that the Lung Foundation offer for those living with PF and IPF. So these include all of the webinars from the Pulmonary Fibrosis series, online booklets and a suite of IPF fact sheets as well. So they can be accessed on our the Lung Foundation website, and I've got the arrows there just to point you to those. And of course, you can access our information and support centre. Their number is on the screen. It is 1800 654 301 if you did want to contact them. I did just want to direct you to the pulmonary rehab as well. If there's anything that you wanted to inquire about pulmonary rehabilitation programs, whether it's virtual classes that they offer or in person, the page can be accessed on our website for further information, and then you can contact the Information and Support Centre as well. Finally, the Lung Foundation do have some amazing peer support options available for people living with PF and IPF. We've got the PF Peer Connect service, which is a telephone-based service specifically designed to connect people living with PF and IPF right across Australia, as well as a number of online peer support groups. So we've got the IPUF group for people living with PF and IPF, and We Belong Together, which is the online group for loved ones and carers of people living with any lung condition. You'll see on the flyers there, you've got the QR codes, so you can scan those and they'll take you to the EOI forms. Again, you can contact the Information and Support Centre for more information as well. So thank you again to our speakers and for everyone who's joined us live today. We really hope that everyone listening was able to gain something from today's webinar. So with that, I'll say goodbye and close the session for today. Thank you.